program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
It's not a novel concept that when you prevent disease and you really take care of your patients, that the cost is lower.
A revolutionary new way to prevent costly hospitalization for seniors. Give them preventative care for free. We'll tell you who qualifies in just a moment. Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Today we're talking about better health over the age of 65. If you're watching us live now and you have questions, give us a call with one of those numbers on the bottom of your screen. Your question may be answered here live on our program by our experts. And the experts answering your questions are Dr. Robin Burnett from Boylan Healthcare and Dr. John Min from University Internal Medicine at Chapel Hill. To call us here at Rex on Call, just dial the number on your screen in Wake County, 919-744-3876, and outside of Wake County, toll free, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, email us your questions to rexoncall@rexhealth.com. You can even find us on Twitter. You know you want to. Send us a message at Rex Healthcare, #RexOnCall. While you're calling in with those questions, it's not a secret. Our current healthcare environment has many doctors seeing more patients, sometimes allowing less time and attention for those with chronic diseases. And as our population ages, those with chronic diseases are becoming more common. Rex Healthcare, a member of UNC Healthcare, has partnered with Alignment Healthcare and Humana to bring more treatment options to qualifying seniors in Wake County.
This Wake Forest location of Alignment Healthcare will open to patients on January 1st, along with locations in Raleigh and Garner. The partnership between Rex Healthcare, Alignment Healthcare, and Humana offers a first-of-its-kind health solution for seniors in Wake County. How much do they have to pay?
Nothing.
Say that again.
They don't have to pay anything.
Nothing.
It's part of their health plan, which has no premium.
So who's eligible? First, you have to live in Wake County. You also have to be a Medicare beneficiary under the Humana Gold Plus plan. And you have to be suffering from a chronic disease such as COPD, high blood pressure, congestive heart failure, diabetes, or chronic kidney disease.
Having a center like this is for the patient, but it's not a novel concept that when you prevent disease and you really take care of your patients, that the cost is lower. We know that hospitalizations are really the driver of most of the costs.
These centers are focused on providing quality care to seniors who may not get the consistent office visits they need. The facilities also have several senior-friendly features.
The carpets are actually non-stick, so those with hearing aids don't get the static in their ears. Also, you'll notice the counter is low enough for a wheelchair.
All the tables are adjustable for comfort during exams, and there's a full-service lab on site.
The turnaround time for all of that is actually 20 minutes, and it feeds into our electronic medical system.
Electronic home health monitoring is even available for those who need it.
If anything comes about, it sends a trigger to us, and we'll actually call the member on the same day, ask if they're feeling well, if they need another medication to take, if they want to come in and have a same-day appointment.
This new model will allow Alignment physicians to work closely with specialists in the UNC Rex Healthcare Network to provide quality care to patients.
Clearly, you recognize that because of the current economic structure of our healthcare system, national system, physicians are challenged every day to see more patients, and as a result, they are oftentimes unable to provide the complex services in a primary care office because they just aren't available.
And our experts, Dr. Robin Burnett from Boylan Healthcare and Dr. John Min from University Internal Medicine at Chapel Hill. They're joining us now. Okay, that system we just heard about, it's not a replacement of a senior's regular doctor. But there's a lot to keep track of. What advice do you have for helping seniors to become really advocates of their own health?
Well, I think that when a patient has an appointment to see the physician, I think the two most important things are for them to know what they want to talk to their doctor about. So perhaps have a list in their mind or on paper is fine, And then the other thing that is very important is to have a updated list of the medications. Even bring the bottles in. Inaccuracies happen quite a few times, and it's good to have an accurate list every visit.
And I mean, is there a way to kind of to cross-reference those medications other than if they just bring it in a list, or does the pharmacy do that? Help do that as well?
There's a lot of different doctors now, a lot of different people involved in the patient care. So I think the best thing to do is just bring in the bag of all the bottles and go over them at every appointment.
Great advice.
There are some of our electronic medical records. We do have a listing of medications, but it's still really wonderful to bring in the bottles, the actual bottles. Even then, we can have patients show us how are you taking the medications and actually line the bottles up on the counter and have them read it to you, take out of the bottle how many medications, how many pills they're supposed to be taking, and then asking them specifically how they're taking these medicines. It's really important.
Okay, and I know it is that time of year again. We're starting to hear all this about reminders to get your flu shots. Talk to us a little bit about how important it is for our seniors to be getting their flu shots this year.
Well, it's absolutely important. I think they estimate that about 30 to 40,000 people die every year influenza, so a lot of those deaths can be avoided if people get the flu shot. And if anybody's ever had the flu, you know that you don't want to get it. A week in bed is about as bad as it gets, so getting the flu shot really diminishes that considerably.
And we're talking, living better after the age of 65 and all those sort of lifestyle changes that happen. But how does care differ for somebody that's over the age 65 versus somebody my age?
Well, I think that it's real important for a patient who is 65 and older to come in and see their physician at least annually. If they're not on any medications, their blood pressures have been well controlled, they haven't had any major issues with their health, at least coming once a year just to get a complete physical examination, or we call it an annual wellness visit. To come in and just have those kinds of assessments done is very, very important. For those that have chronic conditions like hypertension and high cholesterol and have had a heart attack or something, they need to be followed a lot more closely. And I think with Dr. Min and I probably see our patients maybe every 3 to 4 months, at least, for those that have chronic condition issues that we need to address.
And we have heard a lot about, as physicians, you are seeing more patients, but you guys really do take a lot of time with your patients if you're taking all these steps, and that's important, right? And
yes.
These patients don't need to feel like they're being rushed through their appointment with you.
Absolutely, absolutely.
Okay. Talk to us about, I know cholesterol is always a big question. Do I have to take those statin drugs? Are there other options other than the statin drugs?
There are other options, and those are to behavioral modifications are what we like to try first in a lot of cases, and it all depends on the risk factors for the patient. If it's somebody that has very high cardiovascular risk factors, we may be more inclined to try to not talk them into taking the statins, but to put that higher on our radar that it might be something we want to prescribe. Other than that, behavior modifications with dietary changes that could be made, increasing their exercise, and then sometimes fish oil, 1,000 milligrams, but those things need to be 1,000 milligrams a day, but even those, all that needs to be discussed with their doctor. We would always want to sit down, and it's an individualized situation.
There's a lot of questions coming in, so after the break, we're going to come back and answer them. Give us a call or send us an email. Those are the numbers right on your screen in Wake County, 919-744-3876. Outside of Wake County, 877-277-6252. We'll be right back. Welcome back. This is Rex on Call live on WRAL. Today we are answering your questions on living better after the age of 65. If you have questions for our experts, call in now. In Wake County, call 919-744-3876. Outside of Wake County, call us toll free, 877-277-6252. Now let's get to your questions. This is Virginia. Her husband has been taking pain medications for years. He's had back pain for years. Is there a long-term problem with him on oxycodone for his back pain?
Well, I think that the evaluation should involve some type of evaluation. What is the cause of the back pain? And it's difficult to comment on this particular case, but I think that the patient probably should speak with their physician to make sure that it's been evaluated. And as with all medications that can be taken for long periods of time, there's always potential risks and there are potential benefits. And that kind of decision making really needs to be made in the offices, between the doctor and the patient. So.
Okay, on that same, Jenny called. She's been taking antidepressants and anxiety meds for 20 years. Should she be concerned about liver problems for a long term?
There again, we would definitely need to, she would need to talk to her physician about getting those measures made as far as her labs that should be taken for liver enzymes and looking at those things. If she's concerned about that, I would recommend that she goes and she talks to her physician about that.
Okay, Elsie was recently diagnosed with COPD. What exercises can she do besides walking? Are there exercises that she should be doing?
So with that new diagnosis of COPD, it all depends on the severity of it. If it's very mild, I think just getting her exercise, making sure she takes her medications, and then she does her exercises, just your aerobic activity exercises that are recommended by her physician. If it's something more severe, then there is pulmonary rehabilitation that she could be referred to, but that would be up to the discretion of her physician.
We've heard you talk about fall prevention. What does that mean? How do you prevent someone, a senior, from falling? What can they do right now to help to prevent a fall?
Well, falls are a great risk for patients as they get older. We know that balance becomes, the sense of balance diminishes over time, especially after the age of 65 years old. And I think that the ways to improve that is to have a patient continue to exercise regularly so that they have a strong, great gait. For them to try to keep their weight at an ideal body weight so that they're not carrying a lot of extra load that their knees, the hips can't handle. And also things around their home. So not putting things in their way, not having cords in the way of their walkways, not changing the placement of their furniture. These are small things, but we see the mistakes and falls happen with this not too uncommonly, unfortunately.
Talk to us about testing and screening exams, screening colonoscopy. A question even just came in from our call bank. Just their dad, age 75, got a clean colonoscopy. They said, "Okay, you're done. So is that the end? I mean, if you get a clean one at 75, you're done?"
Basically. There are recommendations that we have as far as what we're supposed to be doing and what's covered by insurance and things like that. It depends on, for his dad, if he's having other symptoms that are having constipation that's unexplained, abdominal pain. There may be some other reasons why there may be a colonoscopy that's ordered later in life. But that would be also something that he would discuss with his physician. But there are a certain age, you start at say age 50 and then run it to age 75 is what the recommendations have been.
Okay, and you've told us now how it's different from you treating somebody my age versus somebody who's age 65. What's the difference in the patient? What's the difference between somebody my age coming into your office and somebody who's 65 who's coming to your office? I'm people my age have already diagnosed themselves off Dr. Google. So can you just explain what that's like working with the two populations? What's the difference?
I think there is a generational difference in the sense of how people perceive medical care should be expressed and how it should be managed between the physician. I think that the older generation may be a little bit more used to a little bit more paternalistic attitude, and now it's more of a teamwork, I think, between the physician and the patient. So I think when the patient over 65, maybe who's not used to speaking up, not used to speaking about their concerns, one of the strong recommendations I would have is to really be purposeful about speaking to the physician about your concerns. If you have any side effects from medications, absolutely bring them up.
Okay, thank you very much. Now, we're in the midst of October, which means we are still recognizing Breast Cancer Awareness Month. Rex has been involved in several community events all month, and there are still opportunities left to think pink. How about Ladies Night Out, sponsored by Johnson Health and Clayton? Rex is part of this event next week on October 28th from 5 to 7 p.m. Come enjoy tours, health information, food, and prizes. Find out more information at rexhealth.com/pink-october. And we are coming right back to answer some more of your questions on living better after 65. Give us a call at one of those numbers on your screen. We'll be right back. Welcome back to Rex on Call here live on WRAL. Today we're answering your questions on living better and healthy after the age of 65. We have a lot of questions to get to. Okay, this is Penny. She's 53. She has chronic pain, sleep apnea. She's overweight.
She says she can't exercise easily, but what are your recommendations for weight loss? She needs to take some weight off.
Well, that's a challenge because it sounds like exercise is difficult for her. I think that, but obesity and overweight are big issues for many, many Americans, 50 to 60% of North Carolinians. I would encourage her to start looking at her diet first, and I would look at trying to see where in her diet she can find a place to easily manage out, pulling out a certain number, 100 calories every day. Sometimes it can be as simple as just giving up soda pop or giving up a dessert every day, but that can reap huge benefits in terms of losing 1 pound here, 2 pounds here, and it can be quite a bit.
We actually, along with the diet, as he was saying, when you're trying to lose weight, 75% of what of the plan should be the diet modifications. But we also have to think about the exercise portion too. And if she's got these other issues going on, she could try water aerobics and some other things that could try to change it up for her. Portion control also with her diet would be very helpful too. Smaller portions and just a smaller plate size, that may also help. We also recommend
I know the
that.
Rex Wellness Center has some great water aerobics classes. I've actually seen them as part of the stories we've done. They look like a lot of fun, so check those out. This is Larry. How important is sunscreen after you reach a certain age? Is skin cancer really going to kill me? Larry wants to know.
Well, skin cancer is an important issue, and there's some differing considerations when we think about sun exposure. I still think that it's important to avoid the heavy sun exposure where you're getting the deep burns, but if somebody's getting mild amount of sun exposure, going for a 20-minute walk, I don't know that sunscreen matters that much in this state.
Okay. Billy Edwards from Raleigh. Where should I get my flu shot?
He could get his flu shot at his doctor's office. He could get it at a Walgreens or one of the nearby pharmacies. At the health department, there's lots of different places, just to make sure he gets the documentation and it's sent back to his primary care provider, so they're notified.
So it doesn't necessarily have to be at your primary care
Does not have to be.
Okay. This question's from Fayetteville. COPD, she's 75, and she's having trouble exercising and has a lack of energy, and so she wants to get exercising. Any advice to get started?
I think seeing her physician, going in for an appointment and discussing this, because there may be some other things going on that are creating her fatigue along with the COPD. There's things like anemia, there's all kinds of other issues that could be going on with her. So I think getting a checkup with her doctor's office and then getting some recommendations based on that.
Okay, great. We're going to have a final round of questions after the break. This is Rex on Call. Give us a call at one of those numbers on your screen, 919-744-3876, 877-277-6252. Welcome back to the show. This is Rex on Call, and we're taking a final round of your questions right now. Okay, this is from Tommy in Youngsville. What's included in a wellness visit if you have a chronic decision or just in general? What's included? He's 66 years old.
So in the Medicare population, Medicare a couple of years ago started an appointment available called an annual wellness visit. And this is paid for by Medicare, which allows you to sit down and talk to your doctor once a year about your general health. It doesn't specifically address your specific medical issues. Some physicians may not want to talk about those specific issues during that appointment, but it gives you time to sit down and talk about your general well-being, about your health, about things that you should be worried about starting at the age of 65 years old.
Okay, this is from Mabel. She has high blood pressure and she's been on medication for quite a while. Is there an herb she can take to help lower her cholesterol?
Not so much of an herb that I know of, but I think that if you fish oil, there's coenzyme Q10, there's all kinds of eating. Some people say eating almonds has helped them, or walnuts have helped them to lower their cholesterol. But again, I think that it'd be great for her to check in, because there's so many different interactions with medications and herbal products.
And if it is genetic, so much of that, the herb, fish oil, that stuff is not going to help really.
Right. It may be that it's just a genetic thing for her. It could be, but you just don't want anything that she's taking as an herbal to interrupt anything else that she's taking.
Right.
So.
And how often do you see that lifestyle changes really can affect somebody's
cholesterol?
Really, I've seen it. I've seen people make a serious effort for over a 3-month period of time and really bring down their numbers. But they're very, very diligent about it, making all of the changes, the lifestyle changes that were suggested, and you see some really remarkable changes in patients.
That's
Keep
amazing.
keep in mind that not only does it bring down the cholesterol, but when people are making lifestyle changes, they're exercising more, they're eating better, they're drinking more water. These are things that benefit a person's health anyways. It
Right.
brings down blood pressure, brings down risk of diabetes. So these lifestyle changes are absolutely helpful.
It's so funny, no matter which topic we cover on this show, diet and exercise always seem to be a really common solution. You think we would get it by now. Lewis from Raleigh wants to know where and when should somebody get this shingles vaccine? Is that something you recommend?
Shingles vaccine, he could get the shingles vaccine at the age of 60 and up. I think it may have even been lowered to 50 years old, getting the shingles vaccination, but you can get it. It's written as a prescription in the doctor's office, but it's usually not kept at the doctor's office, even though it could be given there, because of the way that it's kept frozen and it has to be used immediately, or once it thaws 30 minutes, you've got to use it or it expires. So usually at the pharmacy, you go to the pharmacy and they would get the shingles vaccination done there.
Is that something you recommend for everybody over the age of 60?
There again, it's going to be based patient-to-patient basis. It is a recommendation that's put out as one of our recommendations that we try to meet, but it always is an individualized decision between the doctor and the patient. It's a discussion.
Okay. Now, we had talked a little bit about this, and you predict that folks are going to come in maybe confusing flu symptoms with questions about Ebola, which we hear on the news every single day. How are you assuring your patients right now about that?
Well, it's a very scary disease, Ebola is, but the reminder is that influenza is still a much, much, much bigger disease in this country. And what I tell patients is that they can try to do what they can to what they can affect, they should change. So they should go and wash their hands frequently, but most importantly, I really think most patients should try to get the influenza vaccination because it really does work very well.
And 30 to 40,000 people every year will die from the flu, which is way more than we would hear from Ebola. So, and Janet wanted to know, older patients who move to this area, what's the best way for them to find a primary care doctor who takes Medicare? And actually, I have that answer for you. There's a free health information hotline it's called Rex Health Net, where experts will link you up with a doctor and provide you with a referral. That number is 919-784-4490. Again, 919-784-4490. Well, thank you very much, doctors, for being on our show. And thanks to the phone bank. They're still over there busy taking your calls. As always, consult with your physician about any health concerns. And thank you guys again for taking these calls. Finally, if you're looking for a doctor, let's run that number one more time. If you're looking for a doctor beyond today's show, you can call Rex's free health information hotline at 919-784-4490. That's our Rex Health Net, and they will link you up with a good doctor that fits your needs and your insurance. And again, let's talk about Ladies Night Out. That's next on October 28th. That is sponsored by Johnson Health in Clayton. You can go look. They have tours. They have massages and makeovers. rexhealth.com/pink-october. That goes October 28th from 5 to 7, Ladies Night Out. And there's tons of other information about different Think Pink activities on that Rex Health site. Now join us next time for Rex on Call. Our topic will be heart and vascular innovation. That show is November 17th at 1 p.m. right here on WRAL. You can email your questions ahead of time at rexoncall@rexhealth.com. Thank you so much for joining us. We'll see you next time.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.